Hello everyone, so today I will be discussing on Schistosoma, a tissue trematode. So Schistosoma is basically a genus that belongs to the kingdom Animalia and phylum Platyhelminthes and class Trematoda. So first, let's break down the word. Schisto is basically a Greek word which means split or divided, and soma means body. So when we talk about Schistosoma, it basically refers to the unique split body form of this particular parasite. So it has some particular features which is microscopic. There are flatworms and blood flukes. Blood flukes because they use the host's blood as a food source. And Schistosoma refers to the genus, as I've mentioned earlier, and it has three most common species, which are Schistosoma hematobium, Schistosoma japonicum, and Schistosoma mansoni. So these three particular common species, they cause schistomyces in human. So this is an illustration of the split body form of the Schistosoma parasite. As you can see, the female resides within the male canal, and the male are usually shorter and stouter, whereas the female are long and slender. So whenever they are present within the human body, they cause an infection known as schistosomiasis. So let's move on into the epidemiology. So according to WHO, schistosomia affects almost 240 million people worldwide and more than 700 million people that lives in the endemic areas. So this infection is mostly prevalent in tropical and subtropical areas and mainly in the underprivileged community. An estimated 85% of the world's cases of schistosomia are in Africa, and especially in Nigeria, Tanzania, and Kenya. And some of these cases are also present in Asian countries such as Indonesia and the Philippines. So next, we're going to talk about the life cycle. So first, we have the eggs. The eggs, they hatch and they become myricedia, which is the first larval stage. The myricedia will enter into the intermediate host, which are mostly snail's tissue. Within this intermediate host, they will proliferate into sporocysts. These sporocysts are released as sacchari, which is a free-swimming larval stage. They will swim in waters, and once humans come into contact with these contaminated waters, the sacchari penetrates the skin. It will penetrate the skin. Once inside the body, it will lose its tail and become a schistosomily. The schistosomily will enter into the circulation and they migrate to the portal blood that leads to the liver. And in the liver, they will mature into adult worms. So once they are adult worms, they will mate and form eggs, which are released in stools and urine, and the cycle continues. So to fully understand this life cycle, it is important to just understand the six main body forms of the schistosome. First is egg, second is myricedia, sporocyst, sacchari, schistosomily, and the adult worms. Moving on to the pathogenesis, the sacchari present in the contaminated water will penetrate the skin and it will cause infection known as swimmer's itch. So the sacchari will transform into the myricedia, which travels through the bloodstream and develops into a bloodworms within the liver. So the female bloodworms, they will release eggs and as well as some antigens, which will trigger the inflammatory responses of the immune system, specifically interleukin 1 and 6, and as well as inflammatory cytokines are released. So the incubation time is usually 14 to 84 days. And there are two stages of schistosomia infection, acute and chronic, and it also affects the urogenital and intestinal areas. Moving on to the clinical manifestation for acute schistosomia, we have fever, chills, and eosinophilia, whereas for chronic schistosomia, they're divided into two. So if it is an intestinal schistosomia, we have abdominal pain, diarrhea, blood, and stool, whereas for urinary schistosomia, we have hematuria and dysuria. So this clinical manifestation can lead to the increased risk of lung cancer, hypertension, and neurological disorders. So moving on to the lab diagnosis, in microbiology, we can conduct a microscopic stool examination, full blood count to test the amount of eosinophil, and also urine and stool culture. So the diagram below basically illustrates how a schistosoma egg appears under a microscope. Moving on to the treatment, praziquantel is recommended treatment against all forms of schistosomia. It is effective, safe, and low cost, although reinfection may occur. After treatment, the risk of developing severe disease is less. Moving on to control and prevention, proper sanitation and water management. Encourage the use of clean water in your community, use molecicides in controlled areas, and also upgrade the infrastructure. Thank you for watching. You all have a safe holiday and happy studying.